Good afternoon. I'd like to call to order the Health and Human Services and Aging Committee, Wednesday, July 2nd. Pretty soon, we'll all be hopefully celebrating with our families Independence Day. And it's currently 1:04 p.m. Madam Clerk, can we have a roll call, please?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Mr. Castleberry.
Here.
Mr. Hauser. Mr. Schlepper.
Here.
You have a quorum, and let the record reflect that Council President Miller is also in attendance.
All right, thank you. Madam Clerk, has anyone signed in for public comment?
No, Madam Chair, no one has signed in.
We have before us the minutes from the June 4th meeting. Can I have a motion to approve in a second?
So moved.
Moved by Sweeney, seconded by Schlepper. All in favor, please say aye.
Aye.
All right, we have two presentations today and one contract that's in front of us. So we will ask whoever is ready to present, once it's read into the record, for Hunger Network, to please state their name, turn on the green button. So Madam Clerk, if you could read the item into the record.
Resolution 2025-0216, awarding a total sum not to exceed $80,000 to the Hunger Network of Greater Cleveland for the funding for Hunger Network's Hot Meal Sites project from the districts 2, 3, 4, 7, and 8 ARPA Community Grant Funds.
Please come forward. State your name for the names for the record.
I feel like I'm 3 feet tall.
Good afternoon, Madam Chair and council members. I am Julie Johnson, the CEO of Hunger Network.
Emma Messett, Hunger Relief Program Director at Hunger Network.
Thank you so much for having us before you today. I think a lot of you are familiar with us as we've come before you before, but just as a reminder that Hunger Network's mission is feeding our community's future, and our vision is no one goes hungry and no food is wasted. We do have 4 values that all of our programming adheres to, and that is dignity, dedication, collaboration, and innovation.
And at Hunger Network, we have 2 main programs. So today we're going to be talking about the hot meal sites, which fall in our hunger relief programming, but also want to acknowledge our food rescue program, which is kind of like an Uber or Lyft opportunity for volunteering, where a food rescue hero would go to a donor site such as a local bakery or a corporate gas station that has prepared foods left over, actually rescue those goods, a box or 2, and take them to either one of our pantry or hot meal sites or a non-traditional partner such as transitional housing, a domestic violence shelter, Boys and Girls Club, places where there is already going to be a need for that day. But like I said, we'll be going into the hunger relief and the hot meal sites. If you flip the slide here. So these are our 17 hot meal sites across the county. We have district representation in 2, 7, 8, 9, and 10. And so far, all of those hot meal sites are the ones that we were funded through our FEMA Emergency Food and Shelter Program funding, which I'll let Julie go into a little bit.
So I wanted to pull up our slide here to show you and give you an overview of the Emergency Food and Shelter Program funding we've received over the years. And as you can see, it was even high during the pre-COVID years, but then it also declined. It began declining right after the COVID. And so what the yellow number represents at the top is the number of hot meal sites we had at the time. And then you can see the orange line, which is the number of servings our hot meal sites were serving during that time. So we had a large drop off there between 2022 and 2023, and that forced us to remove all of the pantry sites except for Cleveland Kosher Food Pantry, and put that onto our county contract. So at that point, our county contract dollars distributed to the pantries became less because we had more pantries on that, but because of the FEMA funding decrease down to 112.5 and the next subsequent year to 109, we had to do something because there was just not enough cash to go around. So we maintained these 17 hot meal sites and the Cleveland Kosher Food Pantry on this grant for emergency food and shelter because the Kosher Food Pantry is not able to obtain regularly the kosher foods that they need to sustain the folks who attend their pantry at other food sources we normally purchase at, like the Greater Cleveland Food Bank. It's also interesting to note that it became harder for hot meal sites, obviously, to operate during the COVID times. So the number that, if you see two numbers with a slash in the box, like the 24 and the 14, we actually had 24 hot meal sites during COVID, but only 14 of them remained operational due to the threats and the challenges that COVID posed to our community.
So just looking at the impact that these sites that were funded through FEMA have, so over 46,000 meals served in 2024. Just with data from Q1 of 2025, we're seeing over 4,500 meals a month compared to like 3,800 in 2024. So that's about an 18% increase in demand, which puts us at over 50,000 meals for the year, projected at the rate that they're currently being distributed. And then the Cleveland Kosher Pantry also, as we mentioned, receives funding from this source so that they can buy kosher products from an approved vendor. And with this funding, they have helped provide kosher products to 23,577 families in 2024. So it is a significant community that is benefiting from that specific product. And then lastly, there's just a photo on the slide. On the 27th, I was at Mount Olive Missionary Baptist Church, and their volunteers were doing the prep, and they were saying, you know, what's next? What's for August? What are you thinking funding-wise, support-wise? And I said, well, next week, Julie and I are going in front of, you know, this committee. Is there anything you would like us to tell them? And they were just asking, you know, please to consider, and thank you for considering this, because it's just not multi-million dollars, but it is thousands and thousands of meals and community connections that are being fostered through these programs. So with that, we just like to turn it over if there's any questions from you all, and thank you again for having us here.
All right, these funds that are potentially before us to be granted, how long will this funding get you to?
I would estimate that it would be almost a year with the 80,000 because we've already spent through Hunger Network's budget dollars from our general operating fund. Through the end of May, we had spent probably close to $53,000. So if you figure, we spend about $10,000 a month. So that would last for about 10 months if we allocate things exactly the way we do. If we had to cut back, we might be able to make that dollar amount stretch a little bit longer. But to maintain consistency, that would be the number of months.
Okay, by these being one-time dollars, how do you figure on how you're going to sustain after we potentially pass these funding dollars?
Sure. Well, thank you so much. I'm so glad you asked that question. Hunger Network has just completed our strategic plan, and in that strategic plan, we are launching a new initiative through Food Rescue. So we're going to be rescuing even more food than we're currently rescuing, and we are going to be operating what we call Food Rescue Kitchen. Yesterday, we went down to the governor's mansion to graduate from the Food Rescue Kitchen cohort, and we've been in that program for over 1 year now, actually 9 months, and we will open up a kitchen. We're looking at another facility right there on Euclid Avenue, and what that will do is it will rescue more food and turn that into, we're starting off with soups and stews that can be distributed freely throughout our Hunger Network and also through social service organizations we already partner with through Food Rescue. And then we're hoping to ramp that program up from soups and stews to compartment meals that are almost like, your traditional TV dinner, I hate to call it that, as you purchase at the grocery store. Those will be flash frozen and then can also be distributed, or if need be, they could be even offered hot for some folks if that is what their desire is. We do have, anticipate, it's not been passed yet because the state budget is still a little bit up in the air, but La Soup, who was the forerunner of this cohort, has some money in the state budget as well. If that money would go through, that would also advance, we could be a subcontractor, and that would also advance getting our hot meal sites up and running. Additionally, we have sites, or we have foundation grants out there to help perpetuate this as well.
That soup poo, what is, how?
La Soup.
La Soup.
La Soup, it's an organization down in Cincinnati, and Second Helpings out of Indianapolis, Indiana is also in this cohort. There are 8 of them across the country, 6 of them being in the state of Ohio, and they're always advancing and moving on to more food rescue kitchens. So they're now looking for applicants for the next cohort, for the next round of funding and the next round of mentoring throughout the next upcoming year from 2025 to 2026.
I only have one other question. So there are some agencies or hotels that state, so say you have a banquet or something like that, or a fundraiser, and you have leftover food. There have been some hotels that say, due to some laws or whatever, they can't release that additional food off-site to other agencies. How are you gonna combat that, or have you tried to work in that arena?
Yes, we have. So that is actually inaccurate. There is something called the Good Samaritan Law in the state of Ohio. So we rescue food as long as it's not been out on a buffet or it's been served to someone. So as long as they kept the trays temped properly, whether heated or chilled appropriately, we can rescue those foods and distribute them. So a person who would donate or an entity who would donate is protected by that Good Samaritan Law.
Okay. So
And they've
that's-
even upgraded it in the last few years, so it's even, more freeing to those
So
organizations.
can you send us a copy of that Good Samaritan law?
Absolutely, I'd be glad to, Madam Chair.
I know that happened when we had a big fundraiser in 2021, but now that you mentioned, because it was on a buffet.
Correct.
And it was already out, that we couldn't do it. But at
Correct.
least we could know, anybody that's watching that's gonna have an event.
Yes.
We can kind of tell the hotel, don't send it all out
Yes,
at once, so.
yes,
we
that would be
can-
wonderful, yes.
Okay.
And we do that to prevent, obviously cross-contamination and things like that. We have to make sure the food that we're providing is safe. And it is all tracked through the Food Rescue Hero app. So if someone would receive some food and say there was a recall on that food, we would know exactly where it came from, exactly where it went, exactly where it was distributed, so we could contact the parties necessary and recall that food as well. We also monitor the food recalls as well.
Okay, I'd like to open it up to my committee members. Miller?
So, first of all, I would like to thank my colleagues for partnering with me in putting this proposal together. And we know that the impacts of the political winds at the state and federal level are wide-ranging and pervasive, and we're not going to be able to deal with all of them at the local level because we're just not big enough. But in this case, we think we can, and our aim is to provide bridge funding that'll enable you to continue long enough to put other systems in place to maintain this program on an ongoing basis. And also, I would add that our aim is for a total project amount of $100,000, and in addition to the $80,000 that's presented here from the ARPA funds, we're also expecting that the county executive is going to provide an additional $20,000 through the emergency food fund. We're not certain yet exactly what the mechanism is as to how that will be used, but that's our intent.
Thank you so much, President Miller. I really appreciate this. And all members of council, I appreciate you allowing us to come before you today.
Open it up to my colleagues, Councilman Sweeney.
Thank you, Madam Chairwoman, Madam President, and illustrious co-worker. I forgot your title. You're thanking us, right? We're just giving your tax dollars back. And your tax dollars, this is one of the greatest reasons,
Right.
this is one of the best uses we can to give your dollars
you.
back. And when the kudos goes to our council president. You gave him a call. There's a zillion great causes out there, but he said, Marty and other teammates, this is important. And we're just glad to help out. And the beauty of it is, my understanding through the chair is, you need this window to get to someplace.
Nice.
And once you get to the someplace, you'll be okay. But just know you have friends here. So that was more of a diatribe instead of a question, but I just wanted to say thank you.
Thank you, Councilman Sweeney. We're also trying to explore options whereby we might be able to sell some of the food to folks who are able to purchase the food, because the meals will be prepared by a chef and they will be very good and very healthy for you. So the one facility that we're looking at right now would give us an opportunity to do that.
Any other questions? Seeing none, hearing none. Anything else that you would like to add?
If I could have the slides pulled back up, I did forget one point, just to let you know. I apologize. Fabulous. We're going to go to the last slide. I wanted to explain one more thing on the bar graph. That shaded bar graph that you see for 2025, just to give you an idea, from the amount of hot meals we have served from the hot meal sites in 2025, we're on track to outpace the number of hot meals we distributed last year. So if that same volume stays true. But of course, with all of the funding cuts and everything trickling down, we anticipate it will likely even be larger than that. Thank you for allowing me to go back.
She stimulated a question.
Okay.
May I?
Go right ahead.
Thank you. You said meals served. Is it meals served but meals that were needed, or is that a different number?
No, that was meals that were needed, definitely.
No, but I'm just saying, you served this many, but you needed to serve another 20,000.
Oh, yes, I'm sure that if the hot meal sites had had additional funding, they could have certainly prepared more meals to be served, yes.
There's still a need.
Oh, yes,
Meet the need, but
absolutely.
it helps a ton.
Absolutely, absolutely. It's not a solve-all solution, obviously, for everyone in need, but it certainly helps.
Thank you, and thank you.
All right. Any ARPA dollars takes 3 readings. I'm going to ask Councilman Miller, I believe it will be August 5th, will be the 3rd reading, or am I incorrect?
It's going to be sooner than that. It can go to second reading next Tuesday on the 8th. And then the third reading would be on July 22nd for the final passage.
Thank you. I also wanted to add, Hunger Network will continue to fund these sites all the way through July while we're waiting for this funding to hopefully come through.
Thank you.
I'll make a motion to move R2025-0216 to the full council under second reading. Is there a second? Who said second? All right, moved by Conwell, seconded by Castleberry. All in favor, please say aye. Aye. Thank you, ladies.
Thank you so very much. We appreciate your time.
Madam Clerk, we have 2 presentations, and no preference, anyone signed in for, anyone needs to leave early or anything like that?
No.
Okay, so we can go in order. The 2025 Alice Asset Limited Income Constrained Employed Report. I'll invite Ken Surratt up from United Way.
Good afternoon to Chair,
Good
council
afternoon.
members. It's good to be back in chambers here. My name's Ken Sir. I'm the Chief Revenue Officer at United Way of Greater Cleveland. And when we scheduled this presentation, we didn't know that this was really going to be the time where we come to the end of the state budget process as well as the federal budget process. And I think that hopefully the information that we share fits right in with the other presentations that you've had today. What I'm sure many of you are familiar with United Way, and I would say what it was, but I want to tell you a little bit about what it is now. We see ourselves as the front door to support and opportunity in this community. Everything that we do is really around helping people along their economic mobility journey, really to reach financial security. And the main way that people reach United Way and that we provide direct service is through 211. It's a number, 3-digit number, anyone can call anywhere, anytime. And we help connect people to the services in this community. What it also does is create data, right? So we have a real-time data source now, what needs are within this community. What each of you have in your packets are 211 data for your specific districts. Last year, we received over 226,000 calls from every single zip code within this county. But that 211 data isn't the only data that informs the work of United Way. The other big piece is what we want to present to you today is this ALICE report. You heard the acronym. It's a little clunky. However, I think the easy way to think about it is working people who still aren't making enough to meet their basic needs. That's a function of, again, continuing rising costs and the incomes not necessarily being able to keep up with them. And I will tell you what I think is the headline before my colleague, Miriam Kiefer, our Director of Public Policy, comes up to talk more about the data. It really is that we're actually doing better with poverty, but the problem is the ALICE population is growing. Again, it's working people not be able to meet their basic needs, and that's a concern, and that's why it's important 211 and United Way are here to help support these people. So with that, I'll turn it over to my colleague, Miriam.
Good afternoon.
Welcome.
Miriam Kiefer, Senior Director of Public Policy at United Way of Greater Cleveland. So let me just pull up the slides. And so as Ken had mentioned, what the ALICE data does, which is really wonderful, is that it goes beyond data that we receive from the federal government, which just looks at the federal poverty line. The federal poverty line is the same all across the 48 contiguous U.S. states. So it doesn't matter if you live here in Cleveland or in Cuyahoga County or in New York City or Miami, that line is the same no matter where you live, even though the cost of living in those areas are radically different. And so just to give a little bit of context before I dive into the ALICE data, for a family of 4 in the United States, the federal poverty level is $32,150. If you earn $32,151, you are not captured in that federal poverty level data. And so that determines who's eligible for a variety of programs, including Medicaid, SNAP, TANF. And so what the ALICE data does, what's really incredible is that it looks at what's the cost of living in a locality, just your basic needs, housing, food, childcare, healthcare, transportation. It calculates that at the local level, and then it looks at the household types. So it has different variations for household types. So if I am a parent with children that are not school age, it adds a line item for childcare. If I have older adults in my home, it increases the line item for healthcare. And then it looks at, that's what they call the survival budget. And then it looks at, of those, what the average cost of living is, and then how many households in that area actually have enough income to make ends meet. So it goes well beyond the federal poverty level data to really show us, as Ken had mentioned, who's working in our communities, but who does not have enough income to make ends meet, who is still struggling and coming to organizations like Hunger Network and others funded by United Way and by the county. And so I know we only have a few minutes with you today, but I'm just going to dive into what the data looks like for Cuyahoga County. In your packets, you do have the state level data as well. So for Cuyahoga County, again, if we were just looking at the federal poverty line, 16% of households in the county were below the federal poverty line. However, if we look at United Way's ALICE data, another 27% of households do not have enough income to make ends meet. And so if we combine those two numbers together, 42% of our residents in Cuyahoga County do not have enough income to make ends meet. And just to give a sense of what just the bare basics to live in Cuyahoga County costs, for a family of 4, it's $73,500. And if you've got 2 kids in childcare, it's $91,000. Again, if we look at the trends over time, here in Cuyahoga County, poverty has decreased over the past several years, which is a good thing. However, over the past several years, the ALICE data has, the ALICE households have increased. So even though people are earning a little bit more and they're not being captured in that federal poverty line data, they aren't earning enough just to meet their basic household needs. This slide shows just the breakdown of what the costs are for an average household, for just, again, those basic needs here in Cuyahoga County. Again, line by line, housing, childcare, food, transportation. In Cuyahoga County, childcare is the highest expense for any family composition. It's more than rent, it's more than food, it's more than healthcare at $1,900 a month. And again, just to look at the, we also have what a family would need to earn and then what your hourly wage would need to be to sustain that household. And again, if we're just looking at the median income here for the county, it's a little under $62,000. So again, if you are a family of 4, even with kids not in childcare, you don't have enough income to make ends meet. We can also break down the data by neighborhood as well. And so, this slide shows the cities with the highest percentage of ALICE households with populations above 5,000. So East Cleveland is, has the highest percentage of ALICE households at 79%. East Cleveland has the highest percentage of ALICE households in the entire state as well. After that, it's Cleveland, then Bedford Heights. Of the top 10 neighborhoods, all of these neighborhoods outside of Cleveland are on the east side of the county. And then what's also really wonderful about the ALICE data is that we can break down this information by occupation as well. And so of the most common industries for workers here in Cuyahoga County, it's healthcare and retail trade. And these jobs pay $14.50 an hour and $12.05 an hour. And so even for workers that are working full-time, they still don't have enough income to make ends meet. And in particular, we can also break the data down by age group and by education. So for those that only have a high school education, they're more likely to be ALICE, more so than those with college degrees. And younger workers, so workers between the ages of 25 to 44, which should be your highest earning income years, those are the ones that are most likely to be in ALICE as well. Oh, apologies. And then just taking the data from that previous slide, when we look at, if you've got two full-time income earners in the household, even if you're working full-time at those most common jobs in Cuyahoga County, healthcare and retail trade, you would only be making $55,000, $224 a year. You would not have enough income to sustain that a family of 4, and even without childcare costs. So you could be working full-time, maybe multiple jobs, and still not have enough income to just meet your basic costs of living here in the county. And I'll turn over to Ken just to talk a little bit about how we use the ALICE data at United Way.
Sure. Ken Surratt again. just as I mentioned earlier, these data points are important and really inform the work that we do as well. The first really helping identify gaps and other needs in the community, whether it be kind of what are these costs that are rising, what's having the greatest impact on people who are working and their inability to meet all of their needs. But also it could be geography as well. So Miriam showed you the map, and probably was not much of a surprise in the communities that have the largest ALIS populations. But it also helps us just better direct where our resources go as well. We listed some of the examples here. One of the things, United Way used to be much more involved from the beginning with the Earned Income Tax Coalition. It's kind of waned, but now we're picking it back up because we understand that is an important source of income for working people to get those dollars back. There's still tens of millions of dollars that are probably left on the table within this county alone that we want to make sure get back into the hands of our residents. But also the tenants' rights, really trying to help fill a gap of what Cleveland Tenants Organization used to do in this community, making sure renters understand their rights, how to help people remain housed stably. And then lastly, the Family Stability Initiative. And these are just examples. This is an important resource that we partner with CHN Housing Partners, really is around emergency funding for when those one-time things happen to help people get by so that they don't fall further back. So this is important, these data, and important in the work that we do, but also help inform the advocacy and public policy. And I'll turn it back to Miriam, who could talk a little bit more about how this really could impact you all as well.
Thank you, Ken. So I know the state budget process is over. We were very active in advocating for a variety of initiatives with our United Way partners across the state that would have a direct impact on ALIS households. And unfortunately, none of these were included in the state budget. So the biggest one, which would have a huge impact, was state level $1,000 fully refundable child tax credit. It directly targeted ALIS households because it phased out at about $91,000. So again, looking at just those how much income that you need to survive as a family here in Cuyahoga County, it was right at that $91,000 mark. So we were very disappointed to see that that wasn't included in the final version of the state budget. But we'll continue to advocate for policies like this, expansion of the EITC, and we'll also be going down to DC next week to advocate for the maintenance of that enhanced child tax credit at the federal level as well. Unfortunately, the governor's recommendation of increasing eligibility for publicly funded childcare wasn't included in the finalized version of the state budget. Again, going back to, we have the data that shows that childcare is the #1 cost for a family. And so any relief that can be provided to families not only helps them get quality access to quality childcare that they need, but also helps them stay and advance in the workforce as well. As Ken had mentioned, our 211 program, Ohio is one of the 3 states in the country that does not have full 211 coverage for its entire population. Most of Northwest Ohio and Southeast Ohio do not have any 211 services. When you call, there's no service. They do not have the services like what we have here in Cuyahoga County, and we'd love to see that service be offered statewide. And so we've been advocating for the past several years for a statewide allocation for 211 to be able to expand services across the state. And unfortunately, that was not included in the enacted budget. And then last, as Ken had mentioned, the work that we do with CHN, that is provided through the Seymour Family Institute. Historically, we have received a line item in the state budget under TANF for this work, and the governor had introduced that at $2 million, and it was struck out by the Senate and was not re-included back in conference committee. So we'll be advocating to identify other opportunities for funding for that. But unfortunately, like many other organizations that receive TANF earmarks, several of them were removed from the state budget. But, how can council use this data? So one of the things is that, prioritizing policy proposals that address the real cost of living, evaluating program eligibility thresholds using that ALICE survival budget rather than federal poverty line data, since it's not capturing all those individuals who might need and benefit from services. Using ALICE as a benchmark when analyzing the impact of legislation on working families, informing economic development and workforce strategies, and then integrating ALICE data into performance metrics for county-funded programs. And just to give a sense of what some other localities are doing, last year, Columbus City had announced a program that they are working on that specifically targets the ALICE population. They're providing monthly payments of $500 to individuals. So it's like a universal basic income pilot program in Columbus. But they use the ALICE data to determine eligibility for this pilot program. All right. Any questions or comments?
I just wanted to be some clarity on the 32,150. If they have that and above, they're not considered in the federal poverty. Okay.
Correct.
Okay, understand that. Open it up to my colleagues. Any questions in regards?
I have a question.
Councilman Miller?
So you said 32,150 on the poverty? Yeah, okay. On the advocacy agenda, could you say a little bit more about reinstate the governor's recommendation of $2 million in each fiscal year for the Seymour Family Institute?
Yes, so that is an initiative that 6 United Ways across the state partner on to provide work that addresses homelessness, to prevent homelessness for families. So moving out of their school district, unnecessary moves. And so that work we partner with CHN on here in Cuyahoga County. And so that $2 million goes to 6 organizations across the state. Historically, we've received between $1 and $1.5 million in each fiscal year for the program from the TANF line item in the state operating budget. The governor, when he had released his executive version of the budget earlier this year, he had increased it to $2 million. When the budget went over to the House, it was decreased to $1 million. And then when it went over to the Senate, it was strucken out of the bill entirely.
That's unfortunate. Okay, thanks.
Thank you.
Mr. Chair, Madam Chair,
Councilman?
thank you. I agree with Councilman Miller. It's very unfortunate to have that struck. I don't really have a question so much as just a couple comments. I appreciate your presentation, all the information you've provided us today. I do want to thank you especially for breaking it down per district for us so that we can really get an idea what's happening in our specific areas and where we might need to shift our focus. So again, thank you for providing all that information to us today.
Thank you. And if there's any additional information that you need on your district, we're more than happy to help in any way we can. So feel free to reach out or follow up with us at any time.
Councilman Hauser?
The chair to the speaker, seeing that East Cleveland is at the top of the list at looks like almost 80%, is United Way creating some kind of plan specifically for East Cleveland to help those residents?
I'm going to turn that over to Ken.
To the councilman through the chair, always a tough question from you, sir. So right now, there is not any specific programming that is targeting East Cleveland. Again, I think the work that we're doing is really focused on the ALICE population as a whole. Knowing that that is a large percentage of East Cleveland, I do see that resources will be directed in that direction.
Yeah, well, I'm happy to work to create, I think especially the discrepancies between East Cleveland, even Bedford, for example. So I'm happy to work with you to create some kind of plan so we can help improve that for the residents.
Always happy to work with you, sir.
So when, Miriam, you spoke about the Alice report and the 22 to 40-year-olds, is usually the age group that's impacted. Have you guys figured in how does college costs impact these households?
So we have not, so the Alice data right now only shows just those basic costs of living. So it doesn't include a line item for higher education. And so that's one thing that we can look into to see kind of how that impacts not only employment, but whether or not you're part of, if it increases your likelihood of being part of the Alice population by having like student loans or student debt.
You know, the government is making it harder and harder for individuals, even if they are trying to improve their living lifestyles, adding co-pays on just basic necessity as food and medical costs. So just wondering if you guys had taken that into account. Anything else that you'd like to share? This is good information. I'm glad you, it took a minute. I think we rescheduled this a couple times. But like Ken stated earlier, it came at the right time, right? I mean, it just, with all that's going on. So I like that you broke it down per district for us to see the individual needs. So some of us or all of us may be calling to, to advocate for our specific districts and see what we can do. If there's nothing else that you'd like to add, we do appreciate your time and you bringing us this information and interested. Were you trying to get an easy word for the report? Because it's great that it came out to be Alice, so just wondering on that.
Yeah, I don't think we can take credit for that. Our colleagues at United Way of Northern New Jersey, they are the ones who started this initiative, and so I think they came up with the acronym.
Okay. Well, it's very much needed because we always talk about those that are below the federal poverty line, and we've seen what's happening today in our federal level that's impacting families that were above that, and the need is great, so thank you.
Thank you.
Sharon,
The
Madam Clerk, we have state and federal budget proposals and their impact on the SNAP and Medicaid programs, and that will be presented by David Merriman as well as Director Kevin Gowan.
Good afternoon. Thank you very much for inviting the Department of Health and Human Services to make this presentation. My name is David Merriman. I'm the Director of Health and Human Services. I want to move quickly to Kevin Gowan, the Director of Job and Family Services, to make the presentation and to share with you the details we have. But I want to start by making two very clear points. The first of which is we do not yet know what impact the proposed bill and policy framework that is moving through both the Senate and the House on the levy. I think that's a key point. We don't yet know how much burden will shift to the levy. We believe it will be significant. And I don't want to overstate the dramatic impact, but this bill has cleared both houses, and we're all watching our phones to see what's going to happen next with conference or procedurally. But we thought it important for you to have the information that we have as we head into the summer in preparation of our next biennial budget. We watched the state budget close, and we're happy to talk about what our understanding of is next step procedurally. I also understand that Council President has joined us today, and he knows that budget process probably better than anyone in the room. So we're clear what the next steps are. We don't know the impact, and we won't know it for a little bit of time. The other main point that I want to talk about is, as we talk about a very complex set of federal policy changes, our state's response. And one what county options will exist. We'll get into some significant detail. However, the key to all of this is the children, seniors, and families caring for disabled residents and working poor that are counting on these benefits on a daily basis. They're counting on these benefits to ensure they have their housing, they have their food, they have their medical care. And it is difficult at times as we dive into deep, complex political policy and philosophy for us to lose sight of the needs of families and communities. That is our charge. And I think as we just heard from the Alice report, it was just well presented before us, our families have very difficult decisions to make. They have difficult decisions to make. And what we're looking at will restrict the options for the resources they count on. So I'd ask you to consider those neighbors of yours, the constituents you call us every single day about, in some cases your family members, that are counting on these benefits, and which we will not be able to answer. What will it mean for them? I do want to close on one other point. We carry out the law. If the federal government tells us tomorrow to act in a way that is legal and which they direct us to act upon, that's what we're going to do. So when they come to us with policy changes that at times we may struggle with, when it's the law, it's the law. And we have done this time and again with welfare reform and subsequent changes. And at times we are put into places where our employees, our staff are asked to make very difficult decisions and act in, at times, a very draconian way. But if it's the law, it's the law. And I want folks to understand that. So I'm going to ask Kevin to share the presentation. I'm going to be here to answer any additional questions. And I thank you again for taking the time to hear what is emerging information. Thank you.
Thank you, David. Councilwoman Conwell and council members present here today, thank you for allowing us time to talk today about the changes that we're seeing coming down the pipe. I am Kevin Gowan. I am the Job and Family Services Director for Cuyahoga County. And much like David, I want to sort of precurse this with the idea that much of this is breaking. We've heard several versions of both the Senate and the House's budgets. Both have significant impacts to Medicaid and SNAP in particular, and that's what I'm focusing on today. Those are programs that we administer. And while there may be some detailed changes coming into the future, both proposals have, again, significant impact, and they have very similar themes. So we're trying to focus on what we believe is going to happen as a result of looking at both proposals and understanding that some of the core elements are the same in either proposal. The timing may be different, and some of the details may be different, but we wanted to focus on this is what's being proposed. So, and then my final warning is this could change tomorrow. It changed from yesterday, from Tuesday to Wednesday, and it changed. The governor passed his budget recently, or signed off on his budget, and the Senate surprisingly voted through their, the U.S. Senate voted through their budget package, budget proposal, I should say, yesterday morning, or right around noon. So if we could pull the presentation up, thank you. Okay. The proposed changes. So first I want to say a few things about what it is that we do, just to remind everybody the services that JFS provides, and just a couple things about us before we hop in. So, I have this. All right. In Cuyahoga County now, and these are really numbers as of last month, we serve 376,000 residents via the Medicaid program. We distribute roughly $36 million a month in SNAP benefits to 191,000 individuals. The child care voucher program covers 21,000 children. And finally, cash assistance to individuals is about $8,600 right now. There are some other programs that we offer. Those are our core programs. And our programs' eligibility are largely means-tested benefits. They're based on income and expenses in the household. And I wanted to make a note that because we're talking about federal changes, currently, or I should say for 2024, and it's fairly standard, does vary a little bit. 75% of our operating funds come from the federal government. Okay. We have some recent improvements, and I want to thank the support of President Miller and President Conwell as we work through some of the issues we've had in the past with access to services. But starting in 2025, we've been aggressively hiring and onboarding new staff. This has resulted in increased customer service levels with a 75% decrease in wait times, a 30% increase in proportion of calls answered, and an increase in individuals connected to SNAP, as well as timely processing of those applications. But jumping into what the changes are that we're looking at, and I'll go into some detail in a minute, but for food assistance, the SNAP program, the states are to pay a portion of the benefit amount. That is new, that's never happened before in the history of the program. There is a reduction in administrative reimbursement. The federal operating funds we get from the federal government are being cut in half for the SNAP program. And there are increased work population or work required population. The number of people that are going to be work required for SNAP is going up. For Medicaid, there are going to be more frequent renewals. There are going to be work requirements for the first time. This has been tried in several states. I can talk about that a little bit, but this is the first time Ohio is truly launching into Medicaid work requirements, and it is being a change at the national level. And there's the introduction of copays as a new requirement as well.
I have a question.
Councilman?
Director, is there any indication that the state is going to provide any assistance to make up for the cut in half on the administrative reimbursement for food
That the state?
assistance?
Is that the question, Councilman Miller, that the state?
Any indication that the state is going to help with what the federal government is cutting on the administrative side?
There's no indication yet. When the Ohio legislature met regarding the budget, they did not, while they knew federal changes were coming, they did not address them in their budget. There's been some talk that they will need to do a budget adjustment based on when these things take effect. And this is completely what I've heard through the rumor mill, but there has been talk of some state share of some of these changes. So,
Thank you.
Please continue.
So the state change in terms of, okay, where I'm at, sorry. I wanted to, before I get heavily into the detail, I did want to talk a little bit about administrative churn because I'm going to bring it up a couple times during the course of this presentation. Every time a client has to complete paperwork, there's a chance to lose benefits, coverage or benefits, because of missed deadlines, missed documents, or other errors. All right. With the SNAP program, which has multiple check-ins, more so now than the Medicaid program, about 1 in 3 clients who are up for renewal fail to complete on time and end up being reinstated later, usually within 3 or 4 months. Reinstatements usually are more work for my team, and the time spent reinstating the client is time not spent talking on the phone with a new client or doing paperwork for another client who has presented their material timely. This is a Korean SNAP program without extensive work requirements. The work requirement population in SNAP is rather small. It will increase as a result of some of the changes proposed. So, SNAP changes. To get into the detail of what benefit allocation means, in 2024, Ohio distributed $3.2 billion in SNAP benefits. The Senate and House proposals both require the state pay a share of those benefits. Right. It is a sliding scale based on federal error rates. There are different proposals from each, from the House and the Senate. The proposals would result in an additional cost to the state of up to $800 million annually. To show you what that means, or give a brief breakdown of what that is, in the House, I want to state one more thing. The error rate refers to whether or not people received the exact amount that they were supposed to receive in SNAP. Currently, the threshold for an error, to something to be considered an error, is $57. So if, by simple example, someone is supposed to receive $500 a month, and we sent them $550, that's not an error yet by the federal measure. Okay? If we sent them $560, it is an error. It goes in the reverse as well. If we shorted them and only sent them $440, $60 less than they were supposed to receive, that's an error. This error rate is received or calculated by doing random samples at the state level. They pull roughly 1,000, it's a little over 1,000 cases to review to determine if the correct amount was given.
On that point, Director, so the Ohio error rate, how do we, I thought we had systems in place that wouldn't occur, that we would actually, because I thought it was digital, they load stuff up on a card.
In the end,
How do we
where
get
errors occur, you're right, that we certainly were automated, but where errors occur are in either reporting from the family or misinterpretation from the caseworker. Okay, so we give you credit for these expenses. It should have been lower. We averaged your annual income to this. It should have been higher. Whatever it is, that's what generally results in errors. And when we say percentage error rate, it's the percentage of cases that had an error. Okay. The reason that I bring that up right now is the House proposal the House is proposing to reduce that tolerance to 0. So with an error rate of, with an error threshold of $57, the national average last year for errors was 10.93%. It's almost impossible to decide how far up, or to determine project, I should say, how far up it will go if they reduce that to 0. Because it will go up.
We can talk about that in depth. That's spurring more questions from me. Okay.
Okay. So the House proposal also has a higher percentage of share for the state. If you maintain below 6%, you only have to pay 5% of the benefits. If it's, I go through 6 to 8 is 15%, 8 to 10 is 20%, anything over 10% ends up being a 25% share by the state. That's where you get the $800 million, the 10%. Okay. If you keep the threshold, moving on to the Senate, it's a little more forgiving. You keep the current threshold of $57, so the error rates are playing on the same field as we have been. There's no share if the state is below 6%. There's a 5% share for the 6 to 8. There's a 10% share for the 8 to 10. And finally, there's a 10% share, or 15% share for over 10%.
So which one do we have? The state or the House?
Currently,
The Senate or the House?
the state of Ohio is at 9.01%. Actually, the error rates for 24 just came out yesterday. I don't know if they pushed them out because everything else passed, but they pushed them out yesterday. Okay. There are 44 states currently that are above 6%. So that is a major hit to the state budget. There's no indication whether that will be shared with the counties. Because again, they have not addressed this yet. They were waiting to see what the actual budget would say.
So to be clear, Director, those from the House and the Senate, those would be errors. If they produce the error, they'd have to pay back the federal government
They have to,
or reimburse.
some of the mechanism as to how, you're right, you're absolutely right. The mechanism by which the state's going to pay a part of that share is going to have to be worked out by FNS at the federal level. Okay. The administrative cost shift is another way in which the federal government, and it's been phrased that there is a substantial shift of cost over to the states for both the Medicaid and the SNAP programs. This is another one. It reduces the federal administrative match by half. And in the House, it's effective, quite frankly, this year, the federal fiscal year 2026, but that begins in October of 25. The Senate version has it effective federal fiscal year 27, which would make it October of 26. Right. This is an estimate received from the state, or from, the State Directors Association. The estimated cost to Ohio would be roughly $60 million. The estimated increased cost to us would probably be $7 million. That's based on what we spent in 2024. And just as a point of reference, that would equal to roughly 90 caseworkers.
And this increased cost to Cuyahoga Job and Family Services, that could go into effect, what, within a couple of months?
Depending on whether it's the House or the Senate, it's either October 25 or October of 26. The next step change is regarding work requirements. Currently, able-bodied adults without dependents, commonly referred to as ABODs, are required to work a minimum of 80 hours per month in paid or in-kind work. These are, and the age range for that group is 18 to 55. If you're over 55, you don't have to meet those requirements. If you're a minor, obviously, you do not have to meet those requirements. The proposal on the table is to increase the age tolerance to 64 and add some families with dependents. In the House version, any parents with children over the age of 6 would be work required. And in the Senate version, any families with children over the age of 9 would be required.
What about seniors specifically?
I'm sorry,
Seniors that are 55 and older, they don't have any kids or anything like that, but they're
they
retired?
will be, yes. And we are estimating that it adds another 15,000 work required individuals for Cuyahoga County. But yes, seniors age 56 to 64 become part of this population.
Okay. Whether they, if they're disabled or have any medical.
So there
that
are
will-
exemptions currently, those, yes, thank you for pointing that out. There are exemptions currently for people who are disabled in a drug or alcohol abuse program, and yes, under treatment. There are exceptions, yes, exemptions, pardon me. Those do not change, at least
So-
to our awareness.
Another question on that. So with the 80 hours that is being proposed, the 80 hours that is being proposed for them to work, I'll come back to that thought.
The 8 hours is not new, it's simply what they're currently required, and now it's adding population, but I'm happy to come back to any of it. So those are the primary SNAP changes that are out there. Moving on to Medicaid changes. The proposed certification period for renewals. So right now, the certification period for Medicaid is 12 months. Once you sign up, you're on for 12 months. You have to renew after 12 months. The proposed certification period, there is a proposed certification period of 6 months for the expansion population. And briefly, the expansion population is what happened as a result of the Affordable Care Act and largely covers individuals between the ages of 18 and 64, who do not have dependent children and are 138% or lower of the federal poverty level. But that population would move to a 6-month recertification. Currently, there's roughly 100,000 residents on Medicaid that are within the expansion population, or 27% of our total Medicaid population.
Madam Chair. So would the certification remain 12 months for those on Medicaid but not in the expansion population?
I'm sorry, Councilman, the Medicaid population, could you repeat the question? Sorry.
Yes. Would the certification period remain 12 months for those who are on Medicaid but not in the expansion population?
That's our understanding. That's our understanding. A little bit of that's one of the things I fear is that they'll expand that, but right now our understanding is that it's the expansion population, yes. And the 12-month certification would remain for everybody else. As a result of this, we expect more paperwork for recipients, obviously every 6 months instead of 12. More administrative work for us. We have to review those 6-month certification and a higher risk of that churn are referred to. This is one of the, as a side note, one of the ways that the Congressional Budget Office is projecting that Medicaid costs will go down is from this churn that we're talking about with regards to this, and with, quite frankly, regards to the work requirements, which I will segue into. There's a new mandate for the expansion population again to pretty much mirror the ABOD program in SNAP and complete 80 hours per month of community service work, either work, community service, work programs, or educational programs. Based on what's available to us, talking about local impact, some of these people will meet exemptions. Again, this is the 100,000 people and are already working, and we won't have to worry about them meeting work requirements. But there are 35,000 that, at least in our records and our databases, we don't have record of them currently working. They will be subject to those. They will also potentially meet exemptions. They haven't been screened for exemptions before. This population is roughly 7 times the size of what the both SNAP and TANF population is that is currently work required. This is to be implemented no later than December 31st of 2026. I should note that there was I think most of you are probably aware that Ohio applied for a waiver to implement work requirements for the Medicaid program. It's our understanding, although there's been no official word, that because the federal government is moving forward with all states having work requirements on Medicaid, that the Ohio is, I won't say null and void, but is wrapped up into this. This will also, as I mentioned, increase churn as individuals either fail to meet the work requirements, fail to report where they're working, and it will simply increase churn, and we'll see more people being removed from Medicaid roles and reapplying and going for recertification. One thing that I do want to note as I'm talking about this churn piece, understand that there is something in our system is called auto discontinuance. So if they don't meet the requirements, then the system that's got to be here at this point, the system discontinues them. The only reason my people would discontinue people is because they're no longer eligible. When they fail to meet these administrative requirements, largely it's auto discontinuance that's happening. I do have, and I don't want to spend a tremendous amount of time on this, but I wanted you to be aware there are exemptions. These are some, I don't mean to capture all of them. I'm trying to capture the spirit of them. Obviously, if they're already working or enrolled in school, if they're a parent or guardian of a disabled child, if they're medically frail, already in compliance with a work requirement because SNAP and TANF, some of them have work requirements if they're in compliance with that. They're in compliance with the Medicaid work requirement, pregnant women, foster youth, have a substance use disorder or disabling mental disorder, and there are some short-term hardship exemptions as well. So there are exemptions, and we don't know because we've not had to apply exemptions to this population. We don't know what percentage of the population would qualify for those.
A point on substance use disorder or disabling mental disorder. So the substance use disorder,
Is it, I apologize.
oh,
My hearing's not the best.
yeah, the substance use disorder, the Medicaid changes.
Oh, and that's similar to it, if substance use or just if they have a substance use or disorder diagnosed, and some of this we need to see the rules on. These are what's proposed. Ultimately, in this case, CMS would get the rules to us. But if they're suffering from a substance use disorder, and if they follow the SNAP program, then they're going to also want to see that they're in treatment, and then a disabling mental disorder is also listed.
I'm just a little surprised about the substance use disorder, but okay.
The final Medicaid change that I wanted to get into that directly affects our population base is the copay. There's now a copay. Again, this is for the expansion population. Most of the Medicaid changes do apply to the expansion population, but as I said, it's a rather large population. The copay of up to $35 per service doesn't apply. It applies to individuals earning over 100% of the federal poverty level. Not all of the services will require copays. A notable exception would be a regular annual physician visit. But that's new to us. There's not currently a copay. That's the end of the federal changes that I wanted to present today. There are other federal changes that are either not directly affecting the county operations or still in flux as far as we understand, but those are the major changes that affect us. I do want to briefly mention that the Ohio budget, as passed, does still contain what was referred to as trigger language, which is to say that if the federal match for the expansion population drops below 90%, it's currently at 90%, Ohio will exit the expansion program, and the expansion population will no longer qualify for Medicaid. They did not, in either version so far, reduce the expansion funding. They could change in the 11th hour, but they have not reduced the expansion funding yet at the federal level.
Director, I know this is like a moment-by-moment situation, and it's very important since we're going through or preparing for our biennial process. Could you give Levine a update week by week?
Oh, yes. Yes.
Okay, to keep us
Yes.
in.
I have her cell phone number now.
Okay.
Yeah.
Everybody has.
She's going to regret it, but yeah.
Because that would be very helpful, because these things are constantly
As
changing.
things change, and I suspect over the next week, they will change as well.
Okay.
The goal, as stated by the president, is that he wants the budget passed through both houses and on his desk by July 4th. So if that happens, yeah, I'm sure we'll see some changes.
And just a question, I'll open it up to my colleagues. The last slide that you talked about, not all services will require copays. So copays are already gregarious, in my opinion, of putting this on, and they're not affordable. Do you know anything if they're not paid? What happens?
Yeah, unfortunately, yeah. I don't know the answer to that question yet. My presumption is the hospitals are responsible for collecting them, but that's a detail that we're going to have to see when CMS, the Center for Medicaid and Medicare, comes out with their final rules after the budget passes.
Center for Medicaid? Center for Medicaid?
Yes, Center for Medicaid and Medicare Solutions.
I'd like to open it up to my colleagues.
I can certainly go, I do have some potential impact, my final slide, unless,
Thought you had finished. Sorry about that. Continue.
no, that's okay. And some of this is a recap, but up to $7 million in SNAP administrative cost shift to Cuyahoga County. The state may pick up some of this. I'm talking the financial impact at this point. Additional workload from move to 6-month Medicaid recertifications and new work requirements both in the SNAP and Medicaid program. And SNAP, it's an increased population. In Medicaid, it's simply a new requirement. For the community at large, there's an increased risk of coverage loss or churn for Medicaid recipients. Their expanded work requirements will affect older adults and families. There will be longer waits for services. As it's simply the administrative load increases. And also hospital serving Medicaid clients will likely see a revenue decrease. This has been in much discussion at the national level, simply because there will most likely be less people receiving Medicaid, and the potential impact to hospitals that traditionally serve a large Medicaid population is of concern. And that is my final slide.
I was reading from the slide that you gave me the other day.
I
So
apologize.
It was missing.
Yes, I apologize for two
Looked at the one
presentations
that
as well.
was new. That's why I thought you were finished. So I would like to open it up to my colleagues. Any questions? Councilman Lepper?
Hi, Director. Thanks for being here today. I really appreciate it. As I'm listening to this deluge of unfortunate news about funding, all I have is my grandma's head in my voice, and she always used to say, they're nickel and diming us, you know, which is exactly what is happening here. So my question is kind of a public education question. I guess the first piece of it is, what does public education look like for our constituents that are terrified right now? They don't understand what's happening. They're not sure how to navigate this landscape. What does our response, or shall I say your agency's response, look like in terms of educating the people that receive these benefits?
I think this is a first step in letting everyone here know. I think that we need to reach out to the media to let them know the local impact. I don't know if you have been reading the paper over the past 24 hours. I have been, well, the internet version of the paper at this point in the game. But there has been a lot of conversation around this, some of it more emphatic than what I'm saying today. But it's making people aware that these are the changes that are actually happening, that the way that we are getting to a reduction in the Medicaid and SNAP programs is largely through a reduction in the number of people on. And then also the state, especially with SNAP, the cost shift, putting it on the states. And for reference point, the state spends roughly you'll have to forgive me if I'm not entirely correct, $82 million a year on the SNAP program right now across all 88 counties. If they had to share in the cost benefit, or the benefit of the cost of the benefit, and shift some of that administrative cost that the Fed that they're cutting in half right now, it could easily triple if we have a very low error rate, and could be in excess of $800 million if we don't.
Just wanted to add to what Director Gowan said. One point, and this is a really difficult one. Now is not the time for the public to call Job and Family Services with their questions. This is hard. This is going to be a really hard statement, but I'm going to make it, because they are focused on helping the next neighbor get their food assistance. They're focused on helping seniors get Medicaid. So as much as people might want to just pick up the phone and call that number to find out how this impacts them, that's not the call that we want to take. We want to help people get benefits right now. And so we are committed to doing a community process, raising awareness. We're going to work with council. We're going to work with community partners on this. But I need to respect the diligent staff that are in Kevin's office that are just helping the next person up. We want them to stay focused on their job, and it's our job to get the word out, and we're committed to that.
Council
Thank you, David.
President.
That does also remind me, we conduct quarterly forums, largely with community partners, a lot of nonprofits, and other human services agencies in Cuyahoga County. Next one's actually scheduled, I believe, 2 weeks from now, and we're adding this to the agenda so that everybody's aware. And we find that our partners are very good at getting the word out. People come to us for help, or or angry because they've been auto discontinued. They tend to come to our community partners for new information and to keep aware. So we try and keep them informed through our forums and through our newsletter.
Council President.
So, Madam Chair, Director, I have 3 comments. The first is just to express appreciation to you and Director Merriman for bringing us a well-presented and detailed description of the potential changes, a much better explanation than I've heard on any of the news reports, and so it's helpful to have this information. The second thing is to say to our leaders in Washington just how cowardly and mean-spirited this is. You know, they want to throw people off these programs, but be able to say that that's not what we're doing. And so instead of just reducing the eligibility levels, but maintaining a more efficient program, they're making the program harder for agencies and individuals to navigate, and they're just gonna throw people off because people aren't gonna be able to comply with the requirements. So it's just a disgraceful thing that's being done. My third comment is that the potential impacts on Cuyahoga County are large. Just looking at it from the county government perspective, when you combine the $7 million hit on the administration costs, which might be reduced somewhat if the state helps out, but more particularly, the huge amount of additional work that we're going to be required to perform to deal with the work requirements and the more frequent redeterminations. It's just going to create a combined effect that's quite large in effect in relation to the size of the HHS levy, and it's going to be a major impact and difficult to deal with. So I certainly desire to work with you in any way we can to try to get through this and help our residents get benefits. I think Councilman Schlepper's right. Public education is going to be very important if we can help people get better at navigating this. It'll reduce the impact. So those are my comments.
Thank you for those comments. I appreciate that, and I appreciate your support very much, President Miller. Thank you.
Any other questions? Councilman Schlepper.
May I say one thing as well? Just just before the council president shared his perspective, which we all understand and are counting on, Ken Surratt and I were talking about how he was asking, how can United Way help? Because we've started a new proactive customer service model working with them to push messaging out. The key really is what Councilman Schlepper asked, how do we communicate? And it's going to be as every way possible in any environment. But I will just point out one point. This is a pretty dire presentation. This is tough information. But we have a strong community. We have outstanding partners. And I think if we come together, we're gonna be much stronger than if we take this on individually. So I do think it does come to what will we do? What will we do together? And I believe we will come together. And we're gonna wait on the details, but it's coming.
Yeah, I concur. We will do it together. And I think Councilman Sweeney said it earlier, we want people to know that they have friends here at the county and that we will advocate, we will fight for them and what they need. I just had a question about how our hospitals might be impacted. Do we know that there's going to be any shifts to residents that are served or on Medicaid with our hospital systems?
So what I had mentioned before is the concern is that hospitals that have traditionally served a large Medicaid population are going to see a drop in revenues. What I will say, and this may or may not answer your question, but at the national level, they're establishing a rural hospital fund in response to that, because they're at this point concerned there are rural hospitals that are in grave danger of closing as a result of this. We have 30% of our population on Medicaid, a much smaller portion of that, 10% or to do the math in my head, but less than 10% are actually the expansion population we're concerned about. When you start to take those populations away and they don't necessarily have a means by which to pay their bill, it puts those hospitals in jeopardy. And that's been the national conversation around this. and the concern, yes.
Okay, well, my sentiments are the same as Councilman Miller's. I think he put it more delicately than I would have. So I'm a little passionate about our children and families and our seniors out here. Director Gowan, going back to that slide with I think the Medicaid, I think it was in terms of, I'm trying to find it, write notes on the different slides.
So the copays, I think you had another question.
I'll come up in a minute, okay. So I'm just, yeah, the copay was one, but I think it was with SNAP changes. What, in terms of, okay, seniors, I can't find it. The seniors and they're retired and, they now, because the economy has went up, their incomes afford them to get SNAP benefits. You're telling me that we're gonna ask these individuals to now come out of retirement,
For those between,
actually work for $20 is basically what.
there's a couple things to unpack there. The work requirement does end at age 64. Right, but we still have retirees in that, yes. And so, yes, that's now. Some of them may have exemptions around that, but anyone between 55 and 64 is now finding themselves as part of this population. You're absolutely correct. The SNAP amount, when you refer to $20, that's often the minimum amount they qualify, but it's for them at least $60, $23, or $25 now. But nonetheless, yeah, a lot of them are qualifying for the absolute minimum amount, and then they would have work requirements on top of that. Correct.
And where does an individual find a job to complete the work requirements?
That's an excellent question. I'm not sure that I am equipped to answer that question for that group.
Okay.
Madam Chair, one
Councilman
question.
Castleberry.
Thank you. Through the chair, Director Cowan, thank you. I mean, it's sobering information, but it's needs to be said. One thing that stood out to me was based on the information available to us. While some meet the expectations, are already working, roughly 35,000 must begin work activities. Now, where do those people fall in the population? If we're telling 35,000
So the 35,000
new
that I referred to, what we did, and I'll be honest with everyone, as things develop and as we're looking at this, we're trying to pull data from our own sources to say, what does this really mean? And so looking at the roughly 100,000 people that are on within the expansion population of Medicaid, we can show that a little over 60,000 of them have we have evidence that they're working. We have income coming in. We have that in the database. And so there's roughly 35,000 that we don't have that for. Some of them will meet exemptions. Some of them are going to be, some of those exemptions that I talked about already. But looking at that population right now that we don't have verified employment or at least enrollment in school, we're looking at probably 35,000 people. That's where I got that from.
Thank you, because I'm looking at that number, looking at the exemptions, thinking, how could these 35,000 people fall through that, the cracks on there? So some of that's.
Some of them, 35,000 is the ones, all I can say is we have either an education that they're currently enrolled in school, noted, or that they are currently employed. And then the 35,000, we do not.
No, I understand. Okay, well, but I appreciate some clarification, but it is still a little bit of an unknown.
It's a lot of information, so
Yeah.
thank you for the question, appreciate it.
Thank you.
Councilman Hauser.
And so just in closing, I want to echo the council president's sentiments. I'm looking at you guys' recent improvements. I think the 75% decrease in the wait time is great. That's been one of the issues for me, and so I appreciate that. Also, reached out to Director Merriman directly. I think you guys did a great job reaching out to the families at Garden Valley. I was proud to see you guys out there actually talking to the families. And so I just think, you know, the federal government is not going to save us. The state government is not going to save us. And so I think we have to be proactive and get some kind of plan together to make sure we protect our residents.
As Director Martin said, yes, it's time to come together and work together to make us stronger. So thank you, Council.
All right, any other questions, comments? All right, thank you, Director, for delivering needed information. We didn't want to hear it, but definitely needed information. Just the public health crisis, as you're talking to these individuals downstate, please keep that in mind. When COVID hit, you know, there were changes and emergency situations put in place. Maybe you can remind them that, and going forward, that they should prepare for that since we have such drastic cuts in front of us.
Thank you for your support. I appreciate it. Thank you, everyone.
Thank you. Any miscellaneous business? Hearing none, this meeting is adjourned.